In emergency trauma care, preparation is everything. Clinicians and educators need a training system that mirrors the real-world procedures within the trauma bay. TraumaMan is that system. Simulab's hallmark product and the most realistic task trainer available for emergency surgical skills. Built to meet clinicians where they are and grow with them as practice evolves, TraumaMan was built on a foundation of procedural realism. From the moment you make first contact, the experience is designed to simulate what clinicians encounter in the field. Realistic cutting with distinct skin, fat, and muscle layers. Bleeding tissue that responds naturally to intervention. Pleural layer followed by inflating lungs. Every detail engineered for tactile authenticity. The standard of practice for emergency trauma has evolved. When a trauma patient arrives, ultrasound is now one of the first tools clinicians reach for. Users can practice hemothorax drainage and chest tube placement, confirm a pericardial effusion, and perform a pericardiocentesis. The diagnostic step and the procedural step together in one training platform. Completing the trauma ultrasound workflow is SonoSkin, Simulab's solution for training the FAST and eFAST scan. Attach SonoSkin to TraumaMan, and your learners can train the focused assessment with sonography and trauma exam from the first moments of patient contact. Scan the quadrants, visualize pathology, and learn to identify irregular fluid buildup. Since 2001, TraumaMan has set the standard in advanced trauma life support, delivering realistic training that equips your learners with the procedural skills to assess and respond when it matters most. TraumaMan trains your learners on the critical skills needed to treat trauma patients. Chest Drain Tube Insertion, Surgical and Needle Cricothyrotomy, Percutaneous Tracheostomy, Bi-Lateral Needle Decompression, Ultrasound Hemothorax, Ultrasound Pericardiocentesis. The simulator also supports IV Ankle Cutdown, FAST and eFAST exams, SimuCric for portable airway training, Diagnostic Peritoneal Lavage. From first assessment to definitive procedure, TraumaMan covers the complete emergency trauma workflow. Assess, diagnose, intervene, repeat. Everything your learners need for emergency trauma skills in one system, on one platform. TraumaMan, built for simulating the trauma bay, evolved for today's standard of care, ready for what's next. To learn more, connect with your Simulab account representative or visit simulab.com.